Good evening, everybody, and welcome to the weekly PAC webinar with Go Wellness. I'm your host, Annie. You all know that, but hello, nice to see you all. We've got an awesome webinar today. The brilliant Dr. Dan will be talking about gut health and infertility, so I'm excited to hear all about that. Few announcements just planned for session 3. That will be September 16th and 17th. I'm finalizing the location now, but it's gonna be dreamy. So if you're into dreamy, beautiful locations, very cool people, a lot of good education and a lot of fun, then be there. Well, I will let you fine gentlemen kick it off. So gut health and fertility, take it away, Dan.
This is really a discussion about inflammation more than anything. It's and some hormone disruption, but looking at the bigger picture, we're doing a lot of gut health testing. I mean, and it's pretty standard for all of us, right, Regan?
Yeah. Oh yeah.
Yeah. So, first, I think something that's really important to talk about, because this is something I don't think we've ever talked about this, and it's a massive piece. And there's really a good amount of research on this. Is when we're looking at the gut, we're just consider the anatomy. So in the lower abdomen, we have the peritoneum. It's like it's sac, it's holding everything. And in that sac is a fluid called peritoneal fluid. And the peritoneal fluid is super important here, because it's not just like a basic fluid there creating cushioning and kind of preventing any like damage. The peritoneal fluid is full of actual immune components, especially macrophages. A lot of macrophages in the peritoneal fluid.
That would make sense. Yeah.
Yeah, it's got complement proteins, immunoglobulins. There's actually sex hormone binding globules in the peritoneal fluid.
Wow.
Yeah, it's really massively impacted by prostaglandin 3 and prostaglandin 2. So like if your omega fatty acids are off, your prostaglandin 2 is going to be elevated. But it also has like a lot of protein. So it's kind of reminds me of the lower jowl, right? That's right. It's what it is.
That makes perfect sense. Yeah.
And when you go, okay, well, in that fluid, what's taking up the majority of that space in that fluid? When you think of organs, what organs are going to be massively occupying that space? And it's the small intestine and the large intestine.
Yeah.
And what the research is finding is, and this is crazy, is that if the gut is inflamed at all, that fluid becomes entirely inflammatory.
So the cytokines shift, and suddenly it's like, and that may be why it's so difficult to treat colitis and Crohn's disease and some of these chronic conditions, is because everything around it, the environment, it's not just the inside, but it's the outside too.
Yeah, so it becomes like incredibly like inflammatory, and just from the fluid perspective alone. So, and because and all this metabolic waste is in there, because it's like you get these activated macrophages, right? And so you start getting a bunch of oxidative stress. Now that's the first problem, because now your intestinal tract, and more specifically, especially for women, all of the reproductive organs are bathed in this pro-inflammatory, oxidatively stressful fluid, right? So ovaries, they're getting all this stress, all this inflammation. It's massively, the oxidative stress depletes ovarian reserve like that. But the follicular fluid inside the fallopian tube starts to thicken. But this process is the #1 driver of endometriosis.
Wow. And well, endometriosis, we think of like with, I mean, as far as like sloughing off the walls, and we think of like inflamed tissue anyways. And that inflamed tissue, I've seen it migrates, it translocates.
Yeah, it's so crazy. And so now, like, if you think leaky gut, it's not just leaking into the bloodstream, it's leaking into that peritoneal fluid.
That's interesting.
Yeah.
Well, this actually, that I had no idea you're going to be talking about this, but it actually answers a lot of questions about the environment of the body. And if you just think of drainage pathways and you think of the lymphatic system,
Yeah.
I mean, just treating the lymphatic system, getting my female patients specifically doing something as simple as dry brushing makes such a big difference, because I imagine in females more than males, there's probably more of a propensity for this fluid to get backed up based on the hormonal fluctuations.
Yeah, massively. And so, sometimes, you might look at somebody, and let's say we're dealing with a fertility issue, or somebody has a reoccurring gut issue and they can't get it better, or the gut's irritated. When you're looking at that lab work, and all you have to do is look at the anion gap.
Yep.
And if the anion gap's not in there, you can calculate it. It's sodium and potassium. You add those together and you subtract chloride, which is added to the carbon dioxide. That's how you'll calculate that anion gap. And if it's above 12, that's metabolic acidosis. The acidity is oxidative stress, and it alters that peritoneal fluid. So it becomes like the gut can be getting inflamed just from the oxidative stress in the body. And so if that lymphatic drainage is off, it's horrible.
Well, because the anion gap, I mean, if I look at all the blood labs I've read in the last 3 months, hundreds, I would have to say 90% of patients have an elevated anion gap. I mean, it's rare to find one that's in normal range. And so this is pretty interesting. So part of what you're saying is the anion gap, as far as fertility goes, what hormones are going to be most impacted by the oxidative stress that's being thrown off from the anion gap?
Well, one of the first things that occurs is prostaglandin 3s are like the end of the omega fatty acid 3 pathway, right? The DHA, the EPA. Prostaglandin 3, which is all your hormone receptor sites. It's good for the pituitary. And you got to think what omega-3 does. It's like all these anti-inflammatory and immune priming pathways. So when you get inflammation, you kind of switch to this prostaglandin 2 pathway, which is the same pathway that gets activated when people have like a shellfish or a peanut allergy. So just think about that shift. So massive inflammation, we start getting hormone resistance, like systemic, right?
Yeah.
But reproductive tissue, especially estrogenic tissues, are very, very sensitive to prostaglandin 2. And so it causes overgrowth. So it contributes to fibroids, endometriosis. So it really causes excessive estrogen sensitivity.
Wow.
So that's going to be a massive one, right?
Yep.
And just from that fluid shift alone. But because there's a lot of sex hormone binding globulins that'll go up, you start binding up all your androgens and your testosterone too. So, total testosterone may look good, right?
Right.
But free testosterone is going to be in the crapper.
Yeah, to be all bound up. Well, and this is interesting because looking at my female patients who have digestive issues, I always see the she bags much higher. Yeah. And I'm like, well, your hormones are all being held hostage by the Uber driver. It won't let them off. It's bound to it. Their albumin gets high as well, and they have problems.
Yeah, so they're gonna have prostaglandin 2 when it's elevated versus prostaglandin 3. So like when a woman has like menstrual cramps, prostaglandin 2 worsens the cramping, and that's why a lot of times it affects the gut. They have changes in their bowels when they're in cycle, right? So it's going to be more extreme.
Yeah.
So if a woman has retrograde menstruation, on top of having altered fluid, that peritoneal fluid, it's perfect setup for severe endometriosis.
And the peritoneal fluid, how did you get on this research? Who thinks of looking up peritoneal fluid besides Dan Kellams?
I was looking at I was just looking up research on the drivers of endometriosis, and it came across peritoneal fluid. Then I found that there was research that peritoneal fluid is a massive being shifted, either oxidative stress or inflammation, was a massive contributor to infertility because it affects all of the reproductive tissues.
Wow.
And what's crazy, like when it comes to reproduction, because there's so many prostaglandins in there and there's so many complement proteins and some of the immune globulins, it causes antibodies against semen.
And it causes antibodies to get semen?
Against the semen, yeah.
So then you're trying to conceive and your immune system's just like, we're not going there.
So it's crazy. So even if like semen gets, past cervical mucus, which needs to be healthy, then, and we'll come back to that because that's connected to the gut. Once it gets into that tissue, because it's shifted, there can be antibodies against the semen because it's a foreign body, right?
Sure.
And then there's all this inflamed endometrial tissue. So it's like, what really, and it only requires either elevated oxidative stress in the body or a disrupted gut. Either one of those shift that peritoneal fluid so fast that has a massive connection to infertility and all the other different reproductive problems that women will get. But you'll also see it affect men, right? Because it's like chronic inflaming, the tissue. It can affect the prostate. So just it's a massive inflammatory process. So when I came across it, I was like, what? I never, ever considered that.
No, and I've never heard anyone talk about it, which is, this is super interesting. And I apologize. I'm asking questions as a novice here because the, peritoneal fluid, we just it's there and then we move on. Now we're learning that, it's regulating a lot of the biochemistry of the body and physiology, and it's a repository for either pro-inflammatory proteins or anti-inflammatory proteins based on what the gut's doing is what it sounds like. And then the cascade effect is that the reproduction is impaired because of that environment.
Yeah. So, and just think of what that would do to the developing baby. The mom's already got higher likelihood of antibodies during pregnancy anyway. So that's like one of the major connections of the gut to reproductive health.
Well, and let's talk about some of the markers, because Annie and GAP's a big one. Alkaline phosphatase is another one, GGT. I mean, there's beyond just looking at the inflammatory markers themselves, but I could see that. But then in the gut, what are you going to see with beta glucuronidase?
Yeah, so you'll typically see increased beta glucuronidase. Now you can have, and this is really important about the shift. So if you're looking at the gut bacteria and there's more gram negative than gram positive, you're going to definitely have an estrogenic shift there because you're creating and recycling way more estrogens. If the gram negative is not balanced with that gram positive, that's what you'll see. Now, if it's the other side, you're going to see an increase in binding globulins. Gram positive, or you'll see an interference with binding globulins, I should say, because gram positive has an affinity for proteins like albumin. So it tends to over bind up albumin. So you start seeing shifts in globulin and albumin. You just can't, you're not going to have the available transports for most of the hormones in the body. So now you start getting unavailable hormones or transport mechanisms being disrupted. And what's shocking is gram negative bacteria is massive for serotonin and dopamine. It's also massive. It's actually, when it's properly balanced, has a better contributing factor to having an anti-inflammatory effect in the body. So if you don't have it, we're going to have, so the beta glucuronidase is going to be massively upregulated if you have a gram negative dominant microbiome. It's crazy, right? So you get that shift. So looking at that gut bacteria is critical here. And that's the massive driver with endometriosis and uterine fibroids. So, and you already have a problem. Your biggest cause of uterine fibroids is estrogen. But the problem is once someone has the fibroids actually contain aromatase. So estrogen can be normal in the blood, but if a woman has testosterone issues or just have the fact that they have the presence of a fibroid, the fibroid can actually create its own estrogen.
Hey everybody, Regan Archibald here. I hope you enjoyed the Go Wellness show and maybe learned a couple things you could apply to your practice. If you're a healthcare entrepreneur who wants to work in an academic think tank with like-minded humans who are just like you, looking to provide better service, better quality of care for your patients, reach us at info@gowellness.com and we're happy to do a free practice analysis for you.